Great. Welcome, everybody, and thank you for joining this webinar, where you already saw a brief introduction about the program, the Master in Management of Healthcare Management, I should say. And yeah, without of not taking too much from the intro, we of course going to join and hear about this program from the experts. So we have a great lineup of panelists for you. Various professors, students as well. So you'll be in the next 45 minutes or so, you'll be hearing from them more details. And of course, you can interact with us. So by all means, do say where you're logging in from. You can do that through the chat, as I see already some people did that. And also you can write your questions at any time. And please do that through the panel called questions to make sure we don't miss out on them. Also, I have opened up some polling questions, and I will open up a couple throughout the session. So do keep an eye out on that, as we like to hear your background and your feedback, sorry. And also, last but not least, we have a little fun button. I already saw some people found it. So basically at the bottom of the screen, exactly, that's where you can give us your reaction of choice if you hear something you like, and just to make it more fun and interactive. All right, without further ado, let's go over to Adar in Milan, and he'll be introducing himself and the rest of the agenda. Good luck.
Thank you. Thank you so much, Luke, for hosting us. Well, good afternoon, I guess. But, I'm reading the countries, and it's quite of a global audience, so it could be a good morning. It could also be a good evening to everyone. And, well, I would like to say that welcome to this webinar of ours. Today, we're going to go through our 2-year master program in healthcare management, entirely taught in English at our campus in Rome. Well, this background of mine is in Milan, actually, but we're going to go through the different locations of Università Cattolica as well. Well, this program, which is designed for those who are willing to make a lasting impact on one of the most important, one of the most vital and dynamic sectors of our time. As Luke said, my name is Adorko Chirai, and today I will be moderating. I will be, let's say, giving a brief overview of Università Cattolica. I will be conducting, let's say, some brief interviews with our guest of honors. And then, once we are done with our professors and our alumni, I will also get back to you with let's say, another boring but rather super important piece of information with regards to the application procedures, to the entry requirements, and to the application timeline as well. As I said, I'm here representing the International Marketing and Recruitment Department of Università Cattolica, and today we'll be joining the stage with me 3 professors that contribute actively to the Master in Healthcare Management, and we're also going to have the experience from our 2 excellent alumni as well. But before jumping into the program itself, let's start a bit with Università Cattolica as an institution. I mean, yes, let's hope that you probably choose this program, but you're going to attend this program at Università Cattolica. So maybe some background regarding our institution is useful to you. Well, we're talking about the largest non-state university in Europe. Università Cattolica is enormous. So it was founded more than 100 years ago, which is pretty impressive if you consider that we are a private institution. As I said, we're located in different cities in Italy. I myself, well, I've studied in Milan and I work in Milan, but we also have a campus in Brescia, a campus in Piacenza, another one in Cremona. And last but certainly not least, and well, that's what we're here today for, our amazing campus in Rome, our amazing campus in the Eternal City, where we also have, apart from the amazing lecture halls, the campus itself, the amazing hospital. We're going to get to that a bit later. Università Cattolica has 40,000 students. So just to give you an idea of how enormous Cattolica is, and to also give you an idea, a context of how relevant, how important the international community at Università Cattolica is, consider the fact that more than 10% of this overall number of students is made of international students. We're talking about almost 5,000 international students currently attending Università Cattolica. We do work with almost 600 partner universities. I'm going to get into that a bit later so you can understand how relevant, how important, and how structured the global exposure would be for you at Università Cattolica. And in terms of the actual academic offering, well, frankly speaking, I would need like 50 or 60 slides to just present the programs that Università Cattolica has to offer. But let's say that we offer 40 plus English taught programs through all levels, both undergraduate and graduate. And being an Italian university at heart, we do offer more than 200 Italian taught study programs. But obviously, you're surrounded with a lot of options. I mean, Università Cattolica operates in quite of a saturated, let's say, higher education landscape. You could pick from 40,000 universities out there. You could pick from private universities, obviously. You could also pick public universities. But why would you pick Università Cattolica? Well, let's start with the global exposure that I was mentioning, the global international community, the global partnerships that Università Cattolica has, the international network that you would be building while attending Università Cattolica. Being a private university, you would need to consider higher funding for research and student services, deeply connected with the job market, dedicated services to international students as well, to enhance, to improve your experience, even before joining us, but most of all, once you're here. And apart from obviously the services, being here to help, being deeply connected with the job market, with international institutions as well, we need to also focus on academics. I mean, you'll be here to attend a study program after all. And well, if you were to pick Università Cattolica, you would be picking one of the top 450 universities worldwide, according to QS, one of the top 350 universities worldwide, according to Times Higher Education, and a university which has 17 subject areas among the top 350 subject areas. Let's say that you would be picking our program in healthcare management, a joint effort between the Faculty of Medicine and the Faculty of Economics. You would be picking a program which would be listed among the top 300 programs, considering the business and management subject area, and among the top 200 if you were to consider the medicine subject area. So yes, of course, we start with the global exposure, we start with the amazing international community, but then we should not ignore the academic excellence that you would be getting once you're at Cattolica. And speaking of academic excellence, we finally get to the Master in Healthcare Management. 2-year program, entirely taught in English at our amazing campus in Rome. And what other location can be more strategic than Rome? What other location can be more strategic than Rome to study something related to medicine, where we offer this unique integration with the Policlinico Gemelli, top renamed hospital in Italy, among the top 50 hospitals worldwide, according to Newsweek. And there's this extremely amazing collaboration that the program has with its surroundings, with the environment where the program is located, where we can teach you a mix of health economics, innovation management, quality and operations, epidemiology as well, and basically giving you, I would have to say, endless career opportunities, endless employment options once you've graduated. You could start from a managerial outcome and move on to consulting, policy making roles in hospitals, pharmaceutical companies as well could be an option, health agencies, and also international organizations. But without further ado, I think that it's time now to start with our guest of honors. We would be starting with our dear professors Turati and Salmasi as well, speaking, I suppose, directly from Rome. Welcome to both of you. Thank you so much for being here.
Hi. Can you hear us?
Hi.
Right.
Absolutely.
Great.
Perfectly.
Great to be here.
Likewise, thank you so much for being here. I know it's a crazy busy schedule for you, so it means a lot for us that you are both here. And it's also great for students, for prospective students, to get the perspective from the academic staff as well, apart from talking to their peers or alumni as well. And specifically, when we talk about a sector that has faced increasing challenges, such as this one right here, we can talk about the digital transformation to policy reforms, even global health crisis. And students ask us all the time, how does this program equip them to become effective leaders in healthcare management, Professor Turati?
Okay, let me mention the following reasons of why the MSc in healthcare management is designed to equip students with the skills and knowledge that are needed to become effective healthcare leaders. One first reason is that we design a comprehensive curriculum that combines key elements of healthcare management, economics, medicine, so that we give students a broad understanding both from the business and the clinical sides of healthcare. And this is clearly a multidisciplinary approach that ensures that graduates can bridge the gap between healthcare policy and operational needs that are critical for leading healthcare organizations through these transformative periods. Second, the program emphasizes developing leadership skills through case studies, discussion, interaction with both residence faculty and visiting professors. And this exposure to diverse leadership styles and strategic thinking in healthcare management provides students with the tools that they need to guide organizations through complex healthcare landscapes. We also provide real-world experience, with the collaboration from the Agostino Gemelli University Hospital and the practical exposure to healthcare management within an academic hospital environment. And this hands-on experience is essential for understanding the operational challenges healthcare managers face and provides a solid foundation for addressing real-time crises like global health emergency or public health policy changes. Then there is also the opportunity to spend a semester abroad, the global collaboration with overseas universities, and also a global group of students, which adds an international perspective to the education. Understanding healthcare system, in different countries, along with exposure to global health challenges, prepares students to think beyond local boundaries and work in multinational setting or lead international healthcare organization. And finally, let me mention that with technology reshaping healthcare, the program likely includes courses on health IT, data analytics, digital health innovation, like artificial intelligence. And this should prepare students to manage and lead digital transformations in healthcare settings, whether it's implementing electronic health records or think about telemedicine or leveraging big data and artificial intelligence for improving patient care and administrative efficiency. So in essence, our MSc in healthcare management is designed not just to provide theoretical knowledge, but also to cultivate hands-on skills and leadership qualities. And this will allow graduates, we think, to lead healthcare institutions through times of uncertainty and change.
Thank you very much, Prof. Very, very exhaustive answer. I'm super glad to hear that. And let's just dive a bit deeper to the program, the curriculum of the program, the subjects, the courses that our students would be attending. How do you ensure that the curriculum, let's say, remains aligned with, evolving policies, hospital management best practices, perhaps, and most importantly, I would have to say, industry innovations. Professor Salmasi.
So hi to everybody. Thanks for participating and thank you for the question. So my answer is basically that in order to ensure that the curriculum remains aligned with evolving healthcare policies or best practices or industry innovations, we adopt some strategies. And these strategies are the following. So first of all, we try to perform regular curriculum reviews. And we do these reviews in collaboration with healthcare professionals, policymakers, or industry leaders in order to gather insights on current trends and needs. And the inputs that we receive when we do these reviews guide us through some, let's say, curriculum adjustments. Then we have also implemented a feedback system where students and alumni can share their experiences, their direct experiences regarding the curriculum's applicability in real-world settings. Finally, I can say that we try to remain updated on research findings and case studies related to healthcare management and policies, ensuring that these insights are then incorporated into the curriculum through the organization of workshops during lectures. I believe that by actively pushing these methodologies, the curriculum can effectively adapt to meet the demands of the healthcare environment and better prepare students for their future careers.
Thank you. Thank you very much. Students always find themselves, let's say, in a bit of a crossroads situation. I mean, they're surrounded by plenty of options, clearly. There are a lot of universities, a lot of programs that they might be thinking as a good fit for them. What distinguishes this program, our program in healthcare management, Professor Turati, from other programs similar to this, perhaps?
Right, thank you for your question. I think our MSc in healthcare management stands out for several reasons, which distinguishes this program from other healthcare management programs. The first one, I think it's very important, is a clear interdisciplinary cooperation between the School of Economics and the School of Medicine and Surgery. The program uniquely integrates knowledge from the two faculties, both present on the same campus here in Rome. And this multidisciplinary approach ensures that students gain expertise not only in business and management, but also in the clinical and medical aspects of healthcare. You know, you're learning in an environment where economics and management intersects, and students are better equipped to understand the complexity of managing healthcare organizations that balance financial sustainability with patient care quality. Second, this interdisciplinarity is reinforced by the strong connection with the hospital, the Agostino Gemelli University Hospital. The collaboration with the Gemelli Hospital is a standout feature. The hospital acts as a living lab where students can directly apply theoretical knowledge in real-world clinical and operational settings. And this partnership gives students an invaluable hands-on experience in managing healthcare operations, in patient care system, and respond to real-time challenges in a hospital environment. Third, the program's international dimension is a key differentiator. Students had the opportunity to spend a semester abroad, as I said, to complete their thesis in a foreign language. And this exposure broadens their understanding of global healthcare system, regulation, and management practices. You know, we also have visiting professors that facilitate this cross-border dialogue, giving students insights into healthcare management practices from different parts of the world. And the opportunity also to build a strong global professional network. This international network not only provides academic enrichment, but you know, it also connects students with potential employers and partners in the global healthcare market, enhancing their career prospects on an international scale. Fourth, as healthcare increasingly moves toward digital innovation, this program incorporates a forward-thinking approach to digital transformation in healthcare. This focus on technology and innovation prepares graduates to navigate the future of healthcare management, basically, with confidence. Let me mention that the program focuses on a holistic view of healthcare, addressing not only administrative, financial, and managerial aspects, but also the human and organizational dynamics within the healthcare system. And this, I guess, enables students to approach healthcare management in a way that, you know, balance efficiency, I always speak as economist, patient care, and employee well-being.
Thank you so much, Prof, and thank you so much for actually mentioning the Gemelli Hospital, because this would lead to my next question. And I mean, we're not talking about a regular structure. We're talking about Gemelli Hospital, which is globally viewed as an example of excellence. And I wanted to get Professor Salmasi's point of view on how, let's say, how this experience at the Gemelli Hospital would enhance the overall learning experience for our students, even for future students? What would they expect from this, let's say, joint experience?
Yeah, so, well, basically, I can say that it improves the learning experience for students in multiple ways. The first one that comes to my mind is that for sure students have the opportunity to be involved in internships at the hospital. And this allows them to gain hands-on experience in a real clinical setting. There is a direct exposure to patients, medical procedure, hospital operations, and this helps to bridge the gap that exists between theoretical knowledge that is generally acquired in class and practical application that instead can be acquired at the hospital. And this for sure will prepare students for their future professional roles. This is a very important experience that they can do because they are close to the Gemelli Hospital. The second thing that comes to my mind is that since there is this presence of professionals that are working at the Gemelli Hospital and that also are educators in our program, this further enriches the learning experience of students because they have the opportunity to be taught in class by experts, such as, for instance, the hospital's health director, and other specialists that are lecturers in our program. And they for sure provide students with invaluable insights into the latest medical advancements, into healthcare management and real world challenges that are faced in the industry. Then lastly, I would say that we also have the possibility of organizing visits to the hospital as part of the learning process. And this offers students basically a unique chance to observe healthcare environments, interact with medical staff, and better understand the hospital workflows. And these visits complement classroom learning and for sure improve students' overall comprehension of healthcare dynamics. So as a bottom line, I would say that overall the interaction between our faculty and the Gemelli Hospital provide an exceptional educational advantage, combining theoretical knowledge with practical exposure and mentorship from leading professionals in the field.
Thank you so much. Even though I've studied something completely different myself, I've actually visited the Gemelli Hospital a couple of times. And I must admit, again, coming from a completely different background, it's huge. It's really, it never ceases to amaze me how a structure of those dimensions works in that way. And, speaking about, let's say, real life scenarios, I would want to ask Professor Turati on this with regards to, let's say, any innovative teaching methods, research projects, collaborations, let's say, with the healthcare industry that would make this program really cutting edge. Would you happen to mention any, perhaps?
The most simple example, as long as Tao Bui, one of our students, is here, is the project that involved our students in an internship that was focused on evaluating the cost effectiveness of a new technology, which is called holobalance. And this is an innovative system that developed as part of an Horizon 2020 project. And the technology is like that. It uses holograms for personalized virtual coaching and motivation in elderly patients with balance disorders. So during the internship, the students were actively contributing to assessing the economic impact and feasibility of implementing this new technology in clinical practice. And their work involved data analysis, cost-effective modeling, critical evaluation of the technology benefit in improving the patient outcomes, while of course optimizing on healthcare resources. And to add on this, our students played a key role in drafting the final report submitted to the EU Commission And this demonstrates their ability to translate the theoretical knowledge into something that made an impact, evidence-based, healthcare solution. And this hands-on experience not only enhanced their analytical and research skill, but also provided them with the direct exposure to an international healthcare innovation and policy making. And I think these examples highlights how our program bridges the gap between academia and the real-world healthcare challenges, preparing students to, contribute meaningfully to the evolving landscape of medical technology and patient care.
Impressive. Thank you so much. And Professor Salmasi, would you also share an example, perhaps, of how students apply their learning to real-world healthcare settings?
I'm sorry, I think this is the question for Professor Turati, no? This is the question that Professor Turati just answered.
Yeah, all right. So we have the example of our alumni, and I'm sure she will share her experience as well during her slides. All right. Well, I'm gonna go back to Professor Turati. What qualities, according to you, define the ideal student for this program? The right fit for our program, let's say.
This is a very, difficult question, I would say. So the ideal student for the MSc, I think, would possess a blend of, academic curiosity, leadership potential, and also a passion for healthcare. Given that the programs focus on interdisciplinary learning, international exposure, and practical application in real-world healthcare settings, I think that to list some of these qualities, then it should be like that. A strong academic foundation. So it's true that the program is open to students from diverse academic backgrounds, but the ideal candidate would have a solid academic foundation, particularly in areas such as business, economics, healthcare, social sciences. So a genuine interest in the intersection of business and healthcare, which is, I think, essential. Then leadership potential. So the program is designed to develop future leaders in healthcare management. So an ideal students would demonstrate leadership qualities and aspirations. A student should be motivated to take on senior roles in healthcare organization and be passionate about driving positive change within the sector. A proactive attitude, to problem solving, an ability to think strategically, and key traits of an effective leader. As I said, you should have an interest in healthcare and public health. So you need to be genuinely interested in this. You want to make an impact on public health, whether through improving hospital administration, to advance healthcare policy, or to contribute to the health system globally. The student should be eager to engage with current challenges in healthcare, so interested in digital transformation, policy reform, responding to health crisis. Then, of course, other, skills would be adaptability and resilience, because healthcare management often involves navigating complex, changing environment with rapid changes. You should have a global mindset and cultural awareness, given that we have an international focus of the program. The ideal student should be open to cross-cultural learning, to be eager to engage with diverse perspectives. You should be innovative and forward-thinking. With healthcare undergoing digital transformation, you should possess a forward-thinking mindset, should be eager to explore, to contribute to innovation in healthcare management, think about digital health technologies, data analytics, telemedicine, all this stuff. And of course, strong communication and interpersonal skills. You want to be a future leader in healthcare, so you must possess excellent communication skills. You should be independent and self-motivated. The program's initial and practical components require students to be self-motivated, organized, able to work independently. So let me wrap this up. The ideal student for this program is someone who is not only passionate about healthcare management, but also eager to take on leadership roles, drive innovation, adapt to the ever-changing landscape of the global healthcare sector.
All right, so this program would basically prepare our students to adapt in any sort of situation, giving them all sorts of academic knowledge and soft skills on top of the super important academic knowledge. If you were to summarize in one sentence why students would choose this program, I know it's super complicated in one sentence only, but what would that be?
I think that students should choose this EMA program to, say, gain a unique interdisciplinary education that combines together, say, business, medicine, real-world experience in a global context that would prepare them to lead and innovate in the evolving healthcare sector. Let me wrap this up this way.
Thank you very much. Thank you so much. I think that your contribution as an academic staff does make quite of a difference. It helps prospective students to understand the program fully, even to be able, let's say, to compare this program to maybe what they might consider quite similar. These slight differences are actually super important and are, I think, the most important component of the whole decision-making process that students go through. And in order for us to give them additional help and give them an extra hint on why they would choose this program out of all, let's say, similar programs, we have another guest of honor, our Professor Pizzo, visiting professor from University College of London. Thank you so much for being here and welcome.
Thank you for the invitation.
Well, I think that maybe you can start, Prof, with an introduction of yourself, your background, your role within the program, perhaps.
Yes, so I'm a professor of health economics. I currently work at University College London, and I have a background in economics. And it's a long story, but I wanted to be a clinical doctor when I was younger. And then I ended up doing economics, which actually was the best solution because I don't necessarily need to deal with patients directly, but I can help them in another way, being healthy. So I started with a BSc in economics in Padova University, and then I did an MSc in health economics and management in Ferrara University. And then I realized I really liked to do research, and so I did my PhD in economics and management in Padova. And I spent 1 year in University of York, where I learned how to conduct economic evaluation. So my main area of expertise is health technology assessment and economic evaluation of healthcare services. And therefore, as part of this MSc, I'm a visiting professor and I co-lead the pharmacoeconomics module with Professor Salmasi.
All right, thank you so much for the exhaustive introduction. Well, as a person who has great expertise, let's say, in pressing challenges, in future, let's say, challenges that this sector would face, according to you, what would be the most pressing ones in healthcare management today? Let's say both from an economic point of view and a policy perspective as well.
Yes, well, there are many, and I would need a full lecture to explain that. I'm going to share some slides just to give you an idea of what this is about. So hopefully I'm going to be able to share my window here. And you can tell me if you can see that. So main challenge, obviously, rising costs. This is something that is of interest for the NHS, but is also common to most of the main healthcare services, the public healthcare services, so the Italian one and many others. We have workforce shortages and burnout. We have emerging needs like epidemics, world and political changes, epidemiological needs, and equitable access. So just to give you an idea, in terms of rising costs, In the UK, but this is common to many other countries, healthcare represents 20% of the public spending, and there are obviously rising healthcare costs due to general inflation, increase in the drug costs, labor shortages, as we said, new medical technologies that requires more investments, and an aging population that is increasing the demand of healthcare services. So from a policy and economic point of view, policymakers must find a way to control costs without compromising the quality of the care they deliver. And they can do so by controlling prices, by negotiating drug prices, and promoting value-based care. Another huge problem is represented by workforce shortages and retention. In the UK, the NHS represents the 7th world's largest employer. So you can imagine what are the implications when we have shortages of nurses, doctors, other health professionals, especially when they are burned out. And we've seen that COVID has exacerbated that. Which has an impact on quality of care. So from a policy perspective, policymakers need to address the root of the cause of shortages, which is generally due to low wages, long hours, lack of support. And so they need to increase funding for training programs, improving working conditions of staff, and addressing their burnout. Then another problem is represented by epidemic and worldwide political climate. We've seen how COVID, for example, has had impacts on healthcare, but also on people income, productivities, employments, and created a lot of inequities. From a political point of view, just to give you an example of what has happened through Brexit in the UK, this had an impact on workforce, medical supply, and the research funds availability. So political choices then have an impact on the healthcare sector as well. Global conflicts create homeless people, people with untreated communicable diseases, chronic conditions, and mental health. And let's not forget climate crisis. Many of the drivers of climate change are also the drivers of health inequalities. And let's just think about asthma. A third of cases of asthma is represented by pollution. And so policymakers here need to address emerging epidemic and worldwide crises, increasing emergency funding, setting up surveillance measures, and providing logistical support for that. So they need to be prepared. And I guess this MSc is going to give them the skills to be leaders that can be prepared to that. And evolving healthcare needs. We are in an aging population with increased chronic conditions and comorbidities, where we have an increase mental health issue, especially in young people, that requires healthcare system to adapt to changing needs. And so again, policymakers need to support the development and implementation of new technologies, investing in new treatments and drugs, in geriatric care, improving prevention policies, addressing concerns about data privacy and cybersecurity, which is also a key of these MSc. And last, equitable access. We know there are huge disparities in healthcare access due to race, ethnicity, socioeconomic status, geographic location, that can obviously lead to poorer health outcomes in some group of the population, and they can also increase cost in the long term if you don't treat those people in the same way. And so again, policymakers need to implement policies that address these disparities by expanding access to private insurance, improving transportation to access services, and addressing the cultural barriers to care. So I could go ahead, but I'm going to stop here.
Thank you so much. I would listen to this all day long, frankly speaking. And, you know, we're always thinking about the future, how this landscape is evolving, how things are changing, the digital transformation, the changes in policies. And, you know, this one very important and existential question that I have now for you. What do you think is essential for the future of healthcare managers? We have these words that we hear all day long, you know, pharmacoeconomics, HTA, the policies that we already mentioned. What's going on there according to you?
So just to give you an idea of what health technology assessment is and pharmacoeconomics, because there's a huge misunderstanding about that. So I'm going to keep sharing my screen. So when we talk about health technology assessment, health technology assessment is a systematic evaluation of properties, effects, impacts of health technologies, and is a very multidisciplinary process to evaluate the social, the economic, organizational, and ethical issues of health technology. And when I talk about health technology, I mean any kind of interventions, procedures, medication, vaccination, drugs, systems in which health is protected and maintained. And so this multidisciplinary process try to look at the technical characteristic of a new technology, its safety, the feasibility, the clinical effectiveness, and the cost effectiveness. So it's a huge, broad discipline. That's why MSc students, they need to be prepared to work in collaboration with other disciplines like statistics, medicine, epidemiology, and lawyers as well. Pharmacoeconomics is a sub-discipline of health economics, which is a huge, broad discipline, and it refers specifically to the scientific discipline that compares the value of one pharmaceutical drug or a drug therapy to another. And so it evaluates the costs and the effects of a particular product, but also it informs drug pricing, formulary management, medication adherence, and the economic impact of a new therapy. And so it's a very huge discipline that looks into all these aspects, which we teach as part of the MSc. In terms of how HTA and pharmacoeconomics can help the managers of the future, for sure, giving them the evidence they need in order to inform their decisions. And so with this, they can prioritize investments in new technologies, they can optimize the resource allocation and assess the cost effectiveness and the clinical impact of alternative technologies so that you can maximize patient benefits and outcomes, develop evidence-based policies and guidelines, so ensuring that the care that is provided is based on the best available up-to-date evidence, and then understanding the value of the new and the current technologies, considering their economic, social, and ethical implication. Then it also allows to improve healthcare quality and access, which is extremely important. These to identify and promote adoption of technology that improves health, ensuring that there's equitable access to healthcare in different populations, that the technologies that are not particularly good value for money can not be used anymore, and we can replace them with more cost-effective technologies, supporting innovation and further research and development in the future. And last, we can enhance efficiency and sustainability, which is essential nowadays, so we can optimize the delivery of services, we can manage costs, and so do cost effectiveness analysis to understand what's the value for money of new interventions, and not necessarily reduce or cut costs. I always say this in my lectures, but making sure that the investment is justified by an improvement in healthcare population. And then improving the collaboration among the different stakeholders, so clinicians, patients, companies, industries, and adapting to changing and new emerging needs.
Thank you so much, Prof. I'm really glad to have been here, witness of this part of your presentation. Thank you so much. Thank you so much to all of the three professors that have contributed immensely to the content of the presentation until now. And I think it's finally time to present our alumni. Thank you so much for being here, first of all. We're going to start with Tao Bui. Thank you. Welcome. And well, you can go ahead and introduce yourself, a bit of your background. Why did you pick this specific program? How this program has helped you throughout your career until now? Please, the floor is yours.
Thank you so much for the invitation, and it's a pleasure to be here as an alumni of the program. So my name is Thao Pui and I'm from Vietnam. So back in 2019, when I started to looking for something to change my career, at the time I was an anesthetist nurse in Vietnam and I work in cardiovascular department, surgery department for like 5 years, and I trained myself my whole my life in healthcare sector. At the time I was like really passionate about changing the technologies in the hospital where I work, and also interested in the management and strategic roles of the team. So simply as that, I was looking for a program that can help me to step into the manager roles in the hospital. It's really simple. As I think other students in my classmates also at the time was similar situation with me, and so I was in between two decisions whether I go to an MBA program or I go into a healthcare management program. There's another lots of option out there, but then I found the University of Cattolica in Rome, and I was like, oh, that's a really interesting program that combined economic and the medicine, which I didn't find at all at the time in Europe. Very unique program. So I went through the website, I went through the curriculum, and I said, wow, that's quite interesting and really match with what I'm looking for. Matching with the planning, management, the research. But at the time, I also been in the research team of the hospital, so I'm really interested in explore the that area as well. So that's the story where I end up applying for the healthcare management program in Rome. Then what is the next question again, Andor?
First of all, you picked the right program.
Yes.
So forget about the
Yeah.
MBA. This was the right program. Absolutely, we can all agree
Yes.
on that.
Yeah.
But how do you think this program actually prepared you for your career?
Well, honestly, now I found this program like my foundations. When I stepped out of the program and went to the career in my career right now, because it prepared me everything from how to plan and execute a project, learn about different technologies at the moment in the market. A little bit background is that my program was in pandemic time, so it was really chaotic. But I really appreciate that we moved really fast. The school moved really fast and prepare us to get to know the technology. And I learned even in that situation, I learned a lot of doing workshop and project with my classmates. Eventually, it's remotely, but I learned how to communicate with people, even in visually environment. Also, Professor Turati just shared about that we have the opportunity to talk to different leader and lecturer from invited lecturer from different countries, and we learned a lot of how different countries tackle the situation at the time, and which bring me to the mindset of fighting the challenge when I doing something, and that is really important when I do my job at the moment. When I do everything, I need to start with what is the problem, and then what is the solution. I think that's a really simple question, but at the time, going from a clinical background, I didn't prepare myself for those kind of strategic thinking when in the business situation. So that something that I really appreciate. And Professor Bizo and Professor Tamasi here are my favorite teacher at the time. Uh, and thanks to them, I landed my first internship in health technology assessment in another research program. It's called CIFA and I got the internship after I finished. Not finished. I'm about to finish my second year of the master degree, and after that, I'm still with that company at that until now, and I'm working as a project manager in another research funded by the European Union, and become a leading the team to do the AI impact assessment. So like AI-based healthcare product, and evaluate how it impact to the outcomes of the product. And for the student to know background, when we do a research like that, one of the most important outcome that the policymaker, the decision maker, they looking for is the impact, social economic impact of the product. Not only about how the value, clinical value that you bring to the patients, but also how your technology change the social and impact to the social in terms of economic benefit, sustainability of the environment, for example. So those things are really important when we evaluate healthcare technologies. And those knowledge I learned from the master degrees in Cattolica.
Wow, thank you so much. So there's definitely a lot that you have studied in Cattolica, a lot of your learning Cattolica that applies directly to your current role. That's amazing. And you know, that's one of the most important, one of the main objectives for even prospective students, to learn something that will be actually useful in their future careers. Thank you so much, Tao. And we can finally move on to our final guests, but not in terms of importance, obviously. Linda, thank you so much for being here. Welcome. And yeah, the floor is yours. Go ahead with a brief introduction of yourself. Why would you pick a PhD after our master? How did our master shape your interest in that specific area as well? That's also quite interesting.
Well, hello everyone. My name is Linda. I'm Italian, but I'm currently living in the Netherlands because I'm working at the University of Groningen as a PhD student. I got both my bachelor's and master's degree at Università Cattolica in healthcare management, and I graduated last September 2024. While working on my master thesis, I got really passionate about researching, and I got really involved in the role played by networks in healthcare. That's why I decided to apply for this PhD position, which was titled Collaboration and Capacity Challenges in Healthcare Supply Networks, which aligned with my research interests. And then I've been selected, and here I am.
Wow. Well, best of luck, first of all. It's a PhD. That's quite tough. But how did our program, let's say, our program in healthcare management, let's say, shape your research interest in this very specific area? I mean, I know you're dealing with healthcare supply networks. How did our program, lead you towards this area right here?
Well, as it has been said, the wide variety, the wide range of courses that are taught in this program and the different disciplines that you can explore help me to identify my interest, and specifically my research interest, as working also on my master thesis, which focused on stroke networks in Italy. And but also the international context with a group of students coming from all over the world with so different academic backgrounds as well stimulated me first to pursue an Erasmus program at the University of Ghent in Belgium, and later on to apply to this position.
All right, thank you. As it was mentioned earlier, from our professors as well, we're talking about a sector that is actually facing a lot of challenges, and typically faces challenges. And supply chain within this sector is obviously no exception. So this part of the sector also faces some challenges. And how do you think that managerial skills play a role into solving these challenges?
Well, as I'm working at the Department of Operations Management, and more specifically in relation to my research topic, we are addressing the effective operations management and capacity management when facing the transition towards networks in healthcare, with hospitals that are taking part into multiple networks. They are required to rearrange their hospital care portfolio and readapt the capacity management, resource allocation, and integration. That's why managerial skills really help to bridge the gap between the theoretical knowledge with the practical challenges that the real world is facing, especially hospitals entering this and participating in this transition.
Thank you. Thank you so much. I love the whole concept of, bridging theoretical knowledge, theoretical skills to actual, real world scenarios. That's actually what our students are looking for, basically, to have this sort of opportunity after completing a study program. Well, I would like to thank you all so much for your contribution up until now. As I promised earlier, I'm going back with slightly more boring, if I might label it so, part of the presentation, which has to do, with the application procedure. But this is also very important. I mean, once you start the application, you ought to know some piece of information on how to fill the application form. Well, applications are open as we speak. We have a round deadline tomorrow. We have the final deadline for non-European students on May the 7th, the final deadline for European students on June the 25th. So you still have quite some time to prepare the application, to gather your documents, to create the account on our website. Super straightforward, super easy, as if you were to create a social media account. Basically, it will take less than 15 minutes for you to complete the whole thing. The program has a tuition fee of 6,600 euros per year for students living in a European country, and a tuition fee of 9,050 euros for students living in a non-European country. With regards to students living in non-European countries, we do also put in place a lot of partial merit-based scholarships, which, if granted, would lead you to a final tuition fee of 6,400 euros per year. And I say per year because this scholarship is automatically renewed to the second year of the program as well. What do you have to do to get in, basically? We talked about the content of the program, future outcomes, employability, bridge between theoretical knowledge and practical use. Now you simply need to get in. Let's start with the most obvious entry requirement, linguistic proficiency. You need a B2 in English. It could be an academic IELTS. It could be a TOEFL IBT. It could be you attending a bachelor degree entirely taught in English. And then obviously there are some specific entry requirements, let's say on top of the linguistic requirement. Well, we would rather look for a bachelor degree in economics and management. You are also welcome to apply. Consider that this program is quite multidisciplinary. If you have a different background, we evaluate all sorts of backgrounds, all sorts of applications. We're also going to need a motivation letter. Motivation, as our professor said, is crucial. We're also going to ask you for an academic reference letter as well. You can start your application right away. You can scan this QR code. You'll be redirected to the application form. Or if you need any further information, I see that we do have some questions in the chat. We have received some questions. If you find yourself having any sort of doubts, even after the presentation, I'm going to leave this very final slide right here in preview so you can save our contacts and contact us at any time, basically, for any sort of question that you might have. And look, I think we're ready to answer some questions if there are any.
Yes, great. Okay, thank you. Let's go directly to the questions. Sergio has a question. Do you help with finding internships or fieldwork opportunities in the healthcare management program?
I'll take this question. The answer is yes. You have seen examples here. Taudui did an internship. I guess also Linda did an internship. We have many possibilities, also here on campus with the Gemelli Hospital. And actually, with respect to the past, right now we do have this course, which is a new graduate course in healthcare management. We added for prospective students coming from abroad the possibility to learn Italian. Because if you want to work on the Italian labor market, then you need to learn some Italian. And we offer the possibility to learn Italian as well, starting this year.
Great, thank you. Indeed, that was a question I saw somewhere along the line as well. So I think that is being answered. Next question from Goldberg, if I say that right. Are pharmaceutical graduates eligible for the program?
Well,
yes. Okay. Yeah.
No, I'm going to give the floor to the professors, obviously.
No problem. I think it was said in the previous slide that background in economics is, let's say, preferred, but any kind of background will be evaluated. We evaluate each kind of application carefully, and then we decide whether or not the candidate is a fit for.
Okay, thank you. And I think that also answers actually the next question, because Dorcas was wondering if he could apply with a bachelor in economics and a master of social science. So I guess that is confirmative, if I understand.
Absolutely.
If you want to know anything else, Dorcas, let us know. Jonathan is asking, how does the transition to a real work environment look like, about job opportunities, and how does it help to get into a different work institution in Europe and beyond? Anything you can say about that?
Let me pick this. As long as we offer, say, opportunities for an internship, this is the usual way, standard way. And the example by Tao is there for that. Let me also mention the kind of, say, transition that was used by Linda. I mean, she was passionate about doing research, and this program here had her to get a position abroad for a PhD. And actually, we do have the possibility to do the PhD also here on campus, because our course here is in a unique, say, ecosystem where we bridge medicine with economics and the practical, say, learning environment offered by the hospital. And we also have PhDs in, say, public health and healthcare systems. So this is just up to you which road to pursue, say.
Okay, thank you. Next question from Anno. Is there any tip for the motivation letter?
I think I can answer this one. We have an actual template of the motivation letter on our website. You can visit the website that you can find on the very last slide of the presentation and pick your program of interest, which would be healthcare management, obviously. And under the admission process, you're also going to find all documents that you need to upload in your application form. And most importantly, the template of the motivation letter. And this is important. Please stick to the questions that are outlined in the motivation letter. Be as creative as you wish, but stick to the questions, please.
Okay, thank you, and also for that tip. Hopefully that helps. I just promoted I've put the link on the screen, so that what you just saw flying in, that is the course overview. From there you can find more information, so I can recommend to click on it, and at your own pace you can read through all the details and apply from there as well if you like. So let's see, we have more questions. I think those were all answered that I see. Ideal background as well, we went through that. And yeah, maybe the question from Sergio, I think it was answered, but just to make sure, is there flexibility to continue learning Italian while studying the master's program in English?
Yes, as I said, there will be a specific course, 4 credits, by the way, if I'm not wrong, which is just thought for people that want to learn Italian and want to remain working in the Italian labor market.
Okay, thank you. That's good. Let's see if there's any further questions. At this point, I don't see I think they're all answered what I saw before. So that should help. Just want to highlight, maybe good to mention for, we're dealing now with the questions that are given live. I know a lot of people are watching the recording these days as well. So those people that watch the recording, you can all participate in all the interactive options. Although you're watching the recording, you can write questions as well. Of course, we cannot answer them live, but we will be sending them through to the staff of the university, so they can come back to you still later as well. So by all means, do let us know. Also feedback through the polls if you haven't done so. And I know we're rounding up the session soon. If before you leave, do let us know your feedback from the polls. I have one more left. And yeah, I just saw your question coming in, and I actually was just going to ask that because I saw it was the top question in my polling, what information you're still looking at, and Sergio just wrote about the possible support for international students to find accommodation. So what can you say about that? Always popular and
it's a super popular question, actually. And, you know, it would take another presentation, frankly speaking, to go through the accommodation options at Università Cattolica. Luke shared previously the overview of the program. I would kindly ask you, Luke, to share it once again, the link, because within the very same link at the very same website, you can find all sorts of student services for each campus of ours. Focus on the Rome campus, and under accommodation options, you can find all that you need to know, starting from in-campus residents to third housing parties, housing agencies, housing providers, and everything you need to know about the campus in Rome.
Yeah, sorry for having posted over your face, but on the screen, but there it is, the link in the middle, so you can clearly see that. And
this is way more important than my face.
I was not going to say that, but thank you. Anyway, we're slowly coming to the end, as mentioned. Yeah, maybe to round off the session, I have one last poll, but I'll wait with it 1 second. I'd like to hear maybe last words coming from, I don't know, Adar maybe, or any of the professors to round off the session, maybe to have a brief wrap up.
Well, all that I can say is that it might sound a bit of a cliche, but we're always here to help. Do not fear to make the wrong questions. Always try to be proactive. Us as an international office, the faculty, the professors, everyone is here to foster a welcoming international community. So please make sure to get in touch with us.
Great, thank you. And thanks everyone. We're already getting thank yous from the audience as well. So that's great to see. From my end, as mentioned, I have one last polling whilst I put it on the screen to get your feedback. I'd like to thank everyone for joining, especially the professors, of course, Turati and Salmasi, thank you very much, as well as Elena, thanks for joining in, and of course the students. So everyone, thank you, Linda and Tao, for your time and your insights. And I have opened actually this polling there as well. So we appreciate your feedback. And from my side, I'd like to wish you a good day and hope to see some of you maybe in this program together next year. Bye-bye.
Thank you very much.
Bye.
Bye.
Have a good day.
Thank you. Thank you very much. Bye-bye.
Have a good day.